Hello, let's talk about world's first AI-IVF baby born in Mexico.
It seems there might be a misunderstanding in the term iBaby. Based on the recent news, the world's first baby conceived via a fully automated AI assisted in vitro fertilization (IVF) procedure was born in Mexico. Here's a breakdown of this significant medical milestone. What happened? A healthy baby boy was born to a 40-year-old woman in Guadalajara, Mexico, after she underwent an IVF procedure where artificial intelligence, AI, and robotics played a crucial role in the conception. The process. The intracytoplasmic sperm injection, ICSI, a standard IVF technique where a single sperm is injected directly into an egg, was entirely automated. This included all 23 steps of the process, from sperm selection and immobilization to the precise injection into the egg. Location. The procedure was conducted at Hope IVF Mexico in Guadalajara. The technology was developed by Conceivable Life Sciences, a company with operations in both New York and Guadalajara. Embryologists and engineers in New York remotely monitored and initiated each step. Technology involved. The AI system was used to identify the optimal sperm cell, immobilize it with a laser, and position it for injection into the egg. Robotic arms then executed the injection with high precision and consistency. Potential benefits. This automated method offers several potential advantages. Increased precision. AI and robotics can perform delicate tasks with greater accuracy than human operators. Improved efficiency. Automation could streamline the IVF process. Consistent outcomes. Reducing human variability may lead to more reliable results. Reduced stress. Automating repetitive tasks can alleviate workload on embryology lab staff. Optimized timing. The system might help maximize the exact timing of the injection, potentially increasing egg survival. Study results. In the experiment, 5 eggs were fertilized using the automated system, resulting in 4 embryos. In comparison, 3 eggs were fertilized manually, and all 3 resulted in embryos. Future implications. This successful birth is a significant step towards fully automated IVF laboratories. While human oversight is expected to remain a part of the process, AI and robotics could dramatically enhance precision and standardization in fertility treatments, potentially making IVF more accessible and successful for more people. It's important to note that the baby is not an AI baby, in the sense of being artificially created or having AI integrated into its biology. Rather, it is the first baby born as a result of an IVF procedure that was largely conducted by AI and robotic systems.
Yes, this was really a great achievement at the global level.
You're absolutely right. The birth of the world's first baby conceived through a fully automated, AI-assisted IVF procedure in Mexico is a truly remarkable achievement in the field of reproductive medicine. Here's why it's considered such a significant step. Proof of concept. It demonstrates that AI and robotics can successfully perform the intricate and delicate steps involved in intracytoplasmic sperm injection, ICSI, a crucial part of IVF. Potential for increased precision. Algorithms can analyze sperm and guide the injection process with a level of accuracy and consistency that may surpass human capabilities, potentially leading to better fertilization rates and embryo quality. Reduced human error and variability. Automating the process minimizes the risk of human error due to fatigue or variations in individual skills, which could lead to more standardized and reliable outcomes, alleviating strain on embryologists. By taking over the repetitive and demanding tasks of ICSI, the technology can reduce the workload and stress on embryology lab staff, allowing them to focus on other critical aspects of the IVF process. Future implications for accessibility and cost. While the technology is currently in its early stages, it holds the potential to make IVF more accessible and potentially more affordable in the future by increasing efficiency and standardization. Advancement in AI in healthcare. This success highlights the growing role of artificial intelligence and robotics in transforming healthcare, offering new solutions and improving existing medical procedures. This achievement opens up exciting possibilities for the future of fertility treatments and offers hope to many individuals and couples facing challenges in conceiving. It's a testament to the innovative spirit of science and medicine.
Yes, that will definitely help because many of the couples they are facing problems in conceiving, especially in this modern time.
You've hit on a crucial point. Infertility is indeed a growing concern for many couples in modern times. Several factors contribute to this trend. Factors contributing to increased infertility in modern times. Delayed childbearing. More individuals are choosing to postpone starting families to focus on education, career, and personal goals. Female fertility naturally declines with age, particularly after the mid-30s, and male fertility can also decrease with age. Lifestyle factors. Modern lifestyles often involve elements that can negatively impact fertility in both men and women. Diet. Processed foods, high levels of unhealthy fats, and nutrient-poor diets can affect hormonal balance and reproductive health. Obesity and being underweight. Both extremes of body weight can disrupt ovulation in women and sperm production in men. Lack of exercise or excessive exercise. An inactive lifestyle contributes to weight issues, while overly strenuous exercise can sometimes interfere with ovulation. Stress. Chronic stress can affect hormone levels and ovulation in women and sperm production in men. It can also lead to unhealthy coping mechanisms like smoking and excessive alcohol consumption. Smoking. Tobacco use significantly reduces fertility in both sexes. Fertility treatments. Alcohol consumption. Heavy drinking can negatively impact sperm quality in men and ovulation in women. There is no safe level of alcohol consumption when trying to conceive or during pregnancy for women. Caffeine intake. High levels of caffeine consumption may be linked to reduced fertility in some studies. Environmental toxins. Exposure to pollutants, pesticides, and certain chemicals in the environment and workplace can negatively affect reproductive health. Technology use. Some studies suggest potential negative impacts of excessive mobile phone use, particularly carrying it near the reproductive organs, and exposure to electromagnetic fields, although more research is needed. Increased awareness and diagnosis. With greater awareness and more accessible diagnostic tools, more couples are being identified as having fertility issues compared to previous generations where these problems might have gone undiagnosed. Medical conditions. The prevalence of certain medical conditions that can affect fertility, such as polycystic ovary syndrome, PCOS, endometriosis, and sexually transmitted infections, STIs, might be contributing to infertility rates. Male factor infertility. It's important to remember that male factor infertility is a significant contributor to overall infertility rates, accounting for approximately half of the cases. Factors like low sperm count, poor sperm motility, and abnormal sperm morphology are increasingly recognized. The hope offered by AI-assisted IVF. In this context, the advancement of AI-assisted IVF is indeed a beacon of hope. By potentially increasing the precision, efficiency, and consistency of the fertilization process, this technology could improve success rates, leading to more successful pregnancies for couples struggling with infertility. Reduce costs. Automation might eventually help in streamlining the process and potentially lowering the financial burden of IVF. Increase accessibility. Making advanced fertility treatments more widely available. While it's not a panacea, AI in IVF represents a significant step forward in addressing the growing challenges of infertility in our modern world and offers renewed optimism for those who dream of starting a family.
I am feeling so wonder how our day-to-day life affects our reproductive system.
You've touched upon a really important and increasingly recognized area, the profound influence of our daily lives on our reproductive systems. It's easy to think of reproduction as a separate biological function, but it's intricately connected to our overall health and how we live. Here's a deeper dive into how various aspects of our day-to-day affairs can impact our ability to conceive and maintain reproductive health. 1. Stress. How it affects. Chronic stress releases hormones like cortisol, which can disrupt the delicate hormonal balance required for ovulation in women and sperm production in men. It can also lower libido and potentially interfere with the success of fertility treatments. Daily life connection. Modern life is often characterized by high levels of stress from work, finances, relationships, and social pressures. Poor coping mechanisms for stress can exacerbate these negative effects. 2. Diet and nutrition. How it affects. A balanced diet rich in essential nutrients, antioxidants, and healthy fats is crucial for hormone production, egg quality, and sperm health. Deficiencies or excesses of certain nutrients, as well as a diet high in processed foods, unhealthy fats, and sugar, can negatively impact fertility. Obesity and being underweight, often linked to dietary habits, can also disrupt reproductive function. Daily life connection. Our food choices are heavily influenced by convenience, availability of processed foods, and cultural dietary patterns. Busy schedules can lead to less nutritious choices. 3. Physical activity. How it affects. Moderate regular exercise is beneficial for overall health and can positively influence hormonal balance and fertility. However, excessive or very intense exercise can sometimes disrupt ovulation in women and lower sperm count in men, especially for those who are already underweight. A sedentary lifestyle, on the other hand, can contribute to weight issues and related fertility problems. Daily life connection. Many modern jobs are sedentary, and finding time for regular, moderate exercise can be a challenge. 4. Sleep. How it affects. Adequate sleep is essential for regulating hormones, including those involved in reproduction. Disrupted sleep patterns, or chronic sleep deprivation, can negatively impact hormonal balance and potentially affect fertility. Daily life connection. Modern lifestyles often involve irregular work hours, late night screen time, and other factors that can disrupt sleep patterns. 5. Exposure to toxins. How it affects. We are constantly exposed to various environmental toxins in our air, water, food, and household products. These include endocrine disrupting chemicals, EDCs, like BPA and pH phthalates, heavy metals, pesticides, and air pollution. These toxins can interfere with hormonal function, damage eggs and sperm, and negatively affect overall reproductive health. Daily life connection. Our consumption of packaged foods, use of plastics, exposure to pollutants in urban environments, and even some cosmetics and cleaning products can contribute to our daily exposure to these toxins. 6. Substance use. How it affects. Smoking, excessive alcohol consumption, and recreational drug use have well-documented negative effects on fertility in both men and women, damaging eggs and sperm, disrupting hormone levels, and lowering the success rates of fertility treatments. Daily life connection. Social habits, stress, and addiction can lead to substance use. 7. Age. How it affects. While not a daily life affair in the same way as the others, the decision to delay childbearing due to career or personal reasons is a significant factor in modern life. Female fertility naturally declines with age, particularly after the mid-30s, and male fertility also gradually decreases. Daily life connection. Societal trends and individual choices regarding education, career, and relationship timelines often lead to delayed childbearing. In conclusion, our reproductive health is not isolated from the rest of our lives. The cumulative effects of our daily habits, from what we eat and how we manage stress to the environments we live and work in, can significantly influence our ability to conceive and maintain a healthy reproductive system. Recognizing these connections is the first step towards making informed choices that can positively impact our fertility and overall well-being. The advancements in AI-assisted IVF offer hope for overcoming some fertility challenges, but adopting a healthy lifestyle remains a crucial foundation for reproductive health.